Hello, hi, I'm Dr. Preethi Nayak, Consultant Dermatologist and Dermatosurgeon at Cutis Academy of Cutaneous Sciences, Bangalore. Today, we are going to discuss on a topic of male pattern hair loss. Male pattern hair loss is popularly known as male baldness. It is also known as androgenetic alopecia. So, it is a chronic dermatological condition which is progressive in nature, in which there is loss of hair in male population. What is the reason of male pattern hair loss? Actually, it is not fully understood. The cause of male pattern hair loss is not fully understood. There is two reasons which we can give for male pattern hair loss. One is androgens or the male hormones, and one more is hereditary. The name, already I told you, the name is androgenetic alopecia. So, genetic is one component and one more is androgens. So, male pattern hair loss is usually seen after puberty. So, that means that male hormones definitely has some role to play in this male pattern hair loss. And genetically also, you might have seen if any father or grandfather, brother, sister, some uncle, maternal uncle, if they have this hair loss, then you have a tendency to develop hair loss. The hereditary chances of developing male pattern hair loss is only 50%. So, the rest 50% can develop male pattern hair loss by themselves. Means you can be the first in your family to develop the male pattern hair loss. So, what exactly happens in male pattern hair loss? See, what happens is we have this thick terminal hair which starts to thin out as well as become short. This process is called as miniaturization. So, in male baldness, the hair starts to thin out and get shortened, and eventually temporarily the hair will be lost from the hair root. And if we leave like that only without treatment, this temporary baldness will get converted into permanent baldness. So, how do you know that you are going into male baldness? See, this is one of the most common type of baldness in men. So, if you are a male and you have started losing hair in a typical pattern, okay, there is a typical pattern in which you will be losing hair, then it is most probably male pattern hair loss. But then definitely you have to undergo diagnosis to know what exactly it is, because see, not all the hair loss or baldness which occurs in men is male pattern hair loss. So, diagnosis is must. But then yeah, clinically the pattern is very typical, and there are various other ways. When you consult a dermatologist, they will do it to diagnose and confirm that it is male pattern hair loss. The one most important thing is dermoscope. So, by dermoscope, like we dermatologists can make out whether it is male pattern hair loss or any other type of baldness. So, basically you have to understand here, to know whether you are going into male baldness, consulting a dermatologist is must. In some rare cases like 1:10,000 or 1:50,000, there are chances that dermatologist might suggest you for a biopsy to know whether it is male pattern hair loss, but then that's very rare. So, mainly it will be clinical diagnosis, and dermoscopy plays a major role. So, you have to consult a dermatologist to know whether you have this kind of baldness. Prevention is very important here. Prevention is better than cure. This holds very good in male baldness. So, diet is very important. Hair rich diet, which is almonds, amla, pomegranate, ragi, all this you should eat more when you have your diet. And prevention mainly in the male pattern hair loss is like early diagnosis and treatment. Earlier the treatment, much better it is. And I would want to tell you here, there is something like association of this male pattern hair loss with diabetes, hypertension, increased cholesterol, obesity. This whole thing is called as metabolic syndrome, and metabolic syndrome has a direct relation with male pattern hair loss. It means that if in a younger age only you have got baldness, then it is better to get your sugars checked, BP checked, cholesterols, and also if you have an increased weight, then kindly reduce it. So there is a direct association. Then prevention, it doesn't mean that your mother tells you to apply some oil or some friend tells you to apply some egg or curds, you start doing it. Okay, that is not required. Okay, there is a patient of mine who had come, who had applied a lot of hibiscus, this one juices, and he had applied to the hair. Okay, that all causes more of irritant contact dermatitis. It is not required. So you should know this. Prevention is important. For that, early diagnosis and proper treatment is important. So, does this have a cure? Is treatment there? Yeah, definitely it's there. So male pattern hair loss has multiple treatment options. So hair lotions, oral treatment, interventional treatment like PRPs, lights and lasers, and also hair transplantation. The basic and the best treatment for any male pattern hair loss is hair lotions. It is very important. So hair lotions can be anything. It can be peptides, it can be serums, it can be minoxidil, with finasteride, or triple combination, or various other hair lotions are available in the market. So this actually topical minoxidil is FDA approved for male pattern hair loss. In fact, that is the only thing which is FDA approved in the topical, that is lotion formulation. So what exactly this minoxidil does? Minoxidil will increase the hair in the hair root. So already I told you how the hair loss occurs. So it will start increasing the hair in the hair roots, and also it will reverse the changes of androgenetic alopecia. That is, it will convert the thin hair into thick hair. So it will exactly reverse the process. So you might ask me, how long do I have to use this minoxidil, or how long do I have to use hair lotions? I would say till you want your hair, you are supposed to continue your hair lotions. So what exactly happens is, when you start applying minoxidil, then the hair which is there, which has grown due to minoxidil, will start depending on the lotions. It will start depending on minoxidil. Like basically it becomes like food for this hair. So once you stop the lotion, whatever hair you have gained due to minoxidil will fall away. So minoxidil application will be required for a long period. Till you want your hair, you might have to apply minoxidil. There are definitely rare cases where we might stop minoxidil because the disease would have stabilized. I mentioned it is a rare case where usually the disease will get stabilized and then we can slowly stop minoxidil. But then this is rare, so you might have to be mentally prepared to use the lotion for a long time. One thing which you have to understand is the effect of these lotions and systemic absorption or any effect on rest of your body is very minimal. Okay, I'll tell you, it is like crushing these paracetamol tablets, making a paste out of it and applying on your forehead or anywhere. Does it reduce the fever? No, right? Something like that. So when you use these lotions, the systemic absorption is very less, so you need not bother about any systemic side effects. There are few patients who after starting this hair lotion come back telling, ma'am, there is increase in hair loss after starting the hair lotion. Definitely. What happens is, once you start the hair lotion, during the initial phase of starting the hair lotions, there will be increase in hair shedding. This basically happens like the minoxidil, it will start removing all the old unwanted hair and it will make space for new terminal strong hair to grow. That's the reason you will have initially hair fall. So do not panic. Please continue your lotion when you have such hair loss.